There's been a report out today. When Boris Johnson stood for election in 2019 and won that landslide, he talked about levelling up. He talked about the north-south divide being no longer. It was about levelling up and making sure that everybody, north and south, had the same opportunities, the same lifestyles, and the same aims and chances to do things. Now, poverty, according to a report by the Institute for Public Policy Research today, is driving more than 1.3 million people to cases of avoidable depression. 1.3 million people, with areas of the northwest experiencing highest levels of poor mental health. Now, they have said a clear link exists between a lack of education, lack of welfare, and obviously deprivation and mental health in England. They say that areas of the highest poverty were 3 times more likely to have a diagnosis of depression. It makes sense, though. Think about it. Not enough money to live. People are worried about the next paycheck. You're going to keep your job. You're going to feed your family. You're going to pay the mortgage. You're up there, and it's a big suffering thing. Chris Thomas is the senior research fellow who put together this. I think it's a very interesting thing because, as I said, the Tories were all about levelling up. Chris, welcome to Talk Drive. How are you?
Hi, Jeremy. Very well. Good to be here.
Thank you very much indeed. This isn't shocking, is it? I mean, this report might to some be shocking. It doesn't shock me at all. There is a massive north-south divide, and it might be okay with rhetoric in an election to say, I'm going to level it up, but it's not levelled up at all, is it? I worked in Manchester for 15 years. It's an absolute fallacy to say there isn't a north-south divide. There is.
I totally agree. And what we've shown today, as you said, is that that's playing out in mental health outcomes. It's also playing out in physical health outcomes and life expectancy as well. So some really shocking results. What I think is really interesting is that we've seen the government now say that health will be the key of whatever they're calling the levelling up agenda on any given day. We've seen Boris Johnson talk about this, in his leadership election through to his most recent party conference speech. He said he would identify the royal jelly that explained the difference between life outcomes in Blackpool and other parts of the country. But what we've seen is identification of the problem, no action. And what we're saying today is that actually there are things you can act on.
What action? I mean, you guys, the Institute for Public Policy Research, writing a report is one thing. Putting something, as a creditable alternative. What action needs to be taken?
Yeah, what we need to get away from is the kind of short-termism that's defined this agenda over the last, it's decades really. But the kind of short-termism where you can put lots of money into the NHS and cut universal credit at the same time. So our big suggestion is that we get away from that by putting in place a public health budget that's 5% of managed expenditure each year, not new money, just reprioritising money from across Westminster to say, actually, we're going to take these inequalities seriously. Year by year, we're going to set out a funded plan to attack the things that drive, as we're saying today, 1.3 million cases of avoidable depression.
It's interesting because I learned this a long time ago, and as I say, I worked in Manchester for 15 years. It's a vicious cycle, isn't it? Poverty causes depression and mental health. Depression and mental health mean that you can't go back to work, you stay on benefits, and so the system goes round and round in circles. It does. That's an absolute fact. Are there less vacancies up north? Potentially yes. Is there less money? Potentially absolutely yes. And yet there are very affluent areas up north and businesses. I mean, Media City in Manchester is one of the biggest sort of places for radio, TV production, the BBC and commercial sides of broadcasting as well. So it's a difficult one. But I watched with real surprise when that red wall collapsed and went to Boris Johnson. I now believe firmly that was Brexit orientated only because the North does still feel neglected, doesn't it?
I think the kind of sentiment there is definitely a reasonable assumption, isn't it? And I think though there's quite a big opportunity here, which is to say, if the government was really bold on health, they'd have something very tangible in say 2 years' time to take to the electorate, to take to those people that voted Conservative for the first time in the last general election, and say, look, life is genuinely better, but you don't get there if you're cutting universal credit and putting all your money, all your eggs into the acute need department, waiting for people to get sick and then treating it rather than preventing it. And the other thing that's happened over the last 10 years but has continued has been cuts to public health budgets locally. We know that places in the north of England have seen huge cuts to their local public health teams. And we also know that places that saw huge cuts to their local public health teams had worse COVID outcomes, more death than COVID-19. So it's not going well.
It's interesting in that rhetoric's fine, isn't it? We want to level up, but you need a level playing field. I'm not quite sure how you create that level playing field, really, if I'm honest. Is it possible, or is it a dream, pipe dream?
I think I think it's possible. I think it takes real courage, real political courage. I think you have to say, look, we understand that actually there are things that happen before someone ever gets a diagnosis that mean that they might be more likely to be hit by something like depression, like a cancer diagnosis, things that actually, if their life was different, we could avoid altogether. And I think what we need a government to do is to say, we're not going to chime the personal responsibility, it's your own fault narrative that's often come up on this issue. We're going to intervene. We're going to put in place the interventions that, as we're saying today, we can link back to kind of better health. So that would be investment in schools. That would be more investment in welfare and social security. That would be action to bring industry to the north of England. Things like the life sciences, the people that created the vaccine. They were in Oxford, but there are plenty of places in the north of England that have lots of potential that could provide big sectors of skilled jobs. There are things you can do. You just need that consistency of political courage.
I want to ask you something, because there are always, I hope, well, there are two sides to every story. Why do you think it is that in recent years, in this new world we live in, and I wrote a story a couple of months ago before I started here about how anxiety got me, and I never ever thought anything like that would ever happen in my life. Why are we talking about more and more people suffering from depression? Hear me out, so somebody will jump in and think I'm saying the wrong thing. I'm asking a question. Are we brave enough now, more brave, to talk about it? Are people using it as an excuse? Is it real? Is it a label? Is it one of those 2021 labels? What is your truthful? Because every single day we hear anxiety, depression, off work. I'm not saying it's not real. I've been there myself. I'm just saying people didn't talk about it. Are they feeling braver, do you think? Do you think it's easier to put pressure on governments and authorities now because so many people are being that open?
I think people probably are talking about it, and that's in many ways a really good thing, because we know the problem that we're facing. But I'd also say that we can look at the kind of things that have happened. So we draw today, 3 or 4 things that really drive disparities in depression. Things like education, further education, income inequality. And what's really telling is that every time we see something in our data, our analysis that says, that's behind, inequalities in depression, the trajectory is that the budget for that has been cut over the last 10 years. So there is, there's more people talking about it, but there is also this dynamic that some of this comes down to government policy. Some of this comes down to us not preventing depression in the ways that we know work. And there's probably, access to mental health services in the NHS as well, in terms of when people do need them. That's not great either. So I think there's lots of reasons that we're seeing,
And the situation would have been perpetuated, of course, by lockdown without any shadow of a doubt. But here's an interesting one for you. Angela has just said, my friend in Manchester was in lockdown for a year. No wonder mental health is bad up north. She lived in a state of complete and absolute fear as cases were so high. She had literally appalling poverty and living conditions. She had no people visiting, and it drove her to distraction. And you can sort of understand that. I'm not saying the lockdown was for everybody, it was. But if you are living in poverty, if you are living, you can't go outside and walk in the countryside, you're just living on an estate somewhere, and there's high crime and poverty and you can't get enough food, etc., etc., that is going to play on you. I'll tell you what, I'd be really interested. Just hold on 1 second, Chris. If you are up north today, you've heard this report that Chris and the Institute for Public Policy Research has written, that 1.3 million extra cases of depression up north because of this north-south divide. Do you feel neglected up north? Do you feel that the government are all for rhetoric, but actually you're not getting the help, you're not getting the support, you're not getting the belief that apparently there is in the south? We want to hear from you. 0344 499 1000. What do you want to achieve by this policy document, Chris?
So what we'd really like is for the government to back up the awareness of the problem, the kind of talk of royal jelly and levelling up with some investment in good health. So to do the things that we're saying, are really important to avoiding depression, and in many cases actually also physical health conditions. And so for us, that's about having a regular pot of money that goes into the things that we know support good lives, good health. And I think you're totally right, that goes some way to saying that we know lockdown had a big effect. We know we had to do something to stem COVID, but as a government, will do something that will now alleviate some of that impact. So that's what we'd like to see brought forward.
Chris Thomas, a senior research fellow at the Institute for Public Policy Research. Thank you for talking to us on Drive.